We've been hearing a lot recently about immunotherapy. Would you tell us what it is and how it works to treat myeloma?
Yeah, so I think immunotherapy is sort of where everything is really changing the way we look at myeloma. So I will just say, I'll date myself a little bit, but 15 years ago when I was a first year fellow, most people thought that myeloma specifically immunotherapy wouldn't necessarily work for myeloma. So, in all cancer care, we have surgery possibly. In myeloma, we don't use it as much, but if someone has a bone lesion that we need to do, we might do some surgery there. Mm-hmm. We use radiation sometimes if we really need for painful lesions or something that might be at risk for fracture. And we use chemotherapy all the time for treatment. Immunotherapy is actually different types of medications. Some are proteins, some are biologics that we can talk about, but really they harness your immune cells. So all the other white blood cells that are in your bone marrow and in your blood to actually go after the myeloma themselves. So there's different ways we can do that. Again, 15 years ago, most people said, nope, we're not going to be able to use immune therapy for myeloma because plasma cells, which are myeloma cells, are a white blood cell. So how do we turn their sisters, brothers, cousins, whatever we want to call those other white blood cells, how do we turn those into the enemy, or how do we make the myeloma the enemy? And so it took a long time for us to figure it out, but really it's about using your immune cells to kill that myeloma.